a disclaimer, I want to mention that information that I'm sharing today with you is really done for educational purposes only, and that it should not substitute or not be considered to substitute psychotherapy or medical advice from a professional.
Hello everyone, and welcome to our first interview as a part of our weekly Q&A series hosted by the Diversity, Equity, and Inclusions team here at UofTMHA, University of Toronto Mental Health Association. We are a student-run club that aims to break the stigma surrounding mental health and empower students through our mental health journeys, while also practicing diversity, equity, and inclusion. My name is Nuzhat Namiha, and I use she, her pronouns. Today we're here featuring Dr. Melisa Arias-Valenzuela. Thank you so much for joining us today. We are so honored to have you share your experience and insight with the UFT community. Would you like to go ahead and introduce yourself to everyone and maybe give a little bit of background about yourself and your line of work?
Sure, absolutely. Hi, I'm Dr. Melisa Arias-Valenzuela, and I'm a clinical psychologist. I'm licensed both in the provinces of Quebec and in Ontario. And I completed my undergraduate degree in psychology at the University of Ottawa, and then I went on to work on my PhD at l'Université du Québec à Montréal. So throughout my studies, my research interest really lies in the fields of social, cultural, and positive psychology. I was always really interested in learning about how culture shaped our identities, our behaviors, our well-being. And these are interests that I would say still shape my professional work to this day. Because I love thinking about not just how our personal experiences, but also how larger environments, cultural environments in particular, can shape how we think about ourselves, how we behave, how we feel. And then in my field of work, well, since the beginning of my doctoral studies, I've worked with people experiencing a wide range of different mental health struggles, but I would say I very quickly developed an interest and a passion for working with people who struggle with eating disorders, as well as people who are struggling with perinatal mental health difficulties. I just find the intersection of the mind, the body, in both fields really fascinating, and then for that reason I decided to develop specialties working with people struggling in those specific areas. So a little about myself. In terms of professional projects, as of 2021, in October, I opened my own practice, which is called Uprise Psychology and Wellness. It's a private practice that specializes in psychotherapy approaches that incorporate mindfulness, compassion, and positive psychology approaches to our work. I supervise practicum students who wish to develop an expertise in these approaches, as well as give clinical consultation for mental health professionals who wish to deepen their clinical practice. I've also become a qualified instructor in mindfulness-based eating awareness training with the Mindful Eating Training Institute, and I'm working on delivering a few groups. I also very much value community partnerships and collaborations with other mental health professionals or health professionals in general. So at the moment, I'm co-leading an intuitive eating group called The Nourished Mama with another dietitian called Jennifer Neal, and I'm really enjoying that. So I would say that's about it for now in terms of professional work. Yeah.
Yeah, it sounds like you're doing a lot of work with many people and doing a lot of great things in that field. So jumping into more about your work, we know that you specialize working with adults diagnosed with eating disorders. We would love to get some insight that you might have in the development trajectory of these disorders. For example, what your thoughts and professional opinions are on childhood factors, biological factors, environmental/cultural factors that could lead to the development of eating disorders in adults.
Right. So there's many factors that might lead someone to develop an eating disorder, and this of course will vary from one person to the next. Eating disorders affect people of all ages, of all ethnic groups, socioeconomic status, sexual preferences, abilities, body types, gender identities. basically have it all. And there are some predisposing factors as well as risk factors that I'll explain, but I would really kind of keep in mind that this will vary from one person to the other. So there's some biological factors. So specifically when we look at genetic studies, we notice that oftentimes people who struggle with eating disorders have a family history of having other types of mental health disorders, including eating disorders. There's also other comorbidities, including anxiety, depression, PTSD, substance use, OCD, and some personality disorders that we'll also see in people struggling with eating disorders, including borderline personality disorder and obsessive compulsive personality disorder. There's also certain differences in terms of temperament. So people who struggle with eating disorders tend to be a little higher in terms of stress reactivity, negative emotionality, as well as harm avoidance, although this, of course, might vary depending on diagnosis. And I would say that there's also an important nuance to notice here around weight. So our weight, just like the color of our eyes, our height, our hair texture, will be strongly determined by our genes. But unfortunately, people who struggle with being kind of on the higher end of the weight spectrum might be more at risk of developing an eating disorder within a cultural environment that will promote thinness, undermining kind of the importance of genetics when it comes to body shapes and sizes. So those are kind of the genetic biological factors. We then have some childhood factors. So a history of weight-based bullying, something that we see often, as well as family dynamics around food and bodies that can be seen as kind of like commenting a lot on bodies, parents being on diets a lot. Those are some childhood factors that are often reported. And then there's lots of different cultural and environmental factors that might have an impact here. So first, experiencing food insecurity. So it's something that has been widely researched and that we've seen throughout history a lot, that people who experience long periods of food insecurity, such as orphans or people who survive concentration camps, will oftentimes experience binge eating disorder as kind of a result of having experienced that long period of not having enough food and experiencing starvation, even once the food insecurity has passed. So that is something that is noticed. There's also a trauma history, especially physical, sexual violence, or neglect. There are, of course, the experiences of experiencing discrimination based on weight from different areas, being part of diet culture, so being in a culture that really promotes thinness and very much devalues people who live in larger bodies. And there's certain groups that might be a little more at risk also of developing eating disorders. So athletes in particular, participating in sports, especially sports in which there's an appearance-based performance aspect, so ballet dancing, figure skating, gymnastics, or where there's an element of weight cycling. So for instance, we can think of wrestling for beating a certain weight category that might put a person more at risk of developing an eating disorder. We also know that there are higher rates of eating disorders in the LGBTQ plus community, as well as other concordant disorders, including anxiety, depression, and body dysmorphia. And then I would also add that there's additional stressors that might put a person more at risk. So things like dieting, for instance, and by dieting I mean any attempt to intentionally lose weight by restricting food intake, and that includes NOOM, intermittent fasting, keto, all that stuff. So about 20 to 25% of people who diet will actually develop an eating disorder, possibly as an attempt to try to maintain or enhance weight loss, because we know it's been pretty well established that 95% of diets will fail. And that might be just an attempt to actually continue continue in light of that. And there's other stressors also that are noteworthy, especially transitions such as puberty. Going to university, college can be a particular period that puts a person more at risk. And I would want to say also this pandemic that we've been through, right? With COVID-19, we've seen a huge increase of eating disorders. Hospitals have been overwhelmed. Private clinics have been overwhelmed. There's been very, very long wait lists in terms of receiving services. So it seems like just being in a time of stress can definitely exacerbate the development and the maintenance of an eating disorder. So ultimately, I believe that an eating disorder is something that's very multifaceted, it's pretty complex. It requires an in-depth understanding of different factors, and it requires specialized help also.
Thank you for that great answer. Moving on to the next question, something that a lot of people have been doing since COVID-19 is probably scrolling through social media. So social media and celebrity images can have a lot of negative effect on how people view food and body image. So what are some things that we can do to be more confident in ourselves, and how can we work on developing a healthy relationship with the food that we eat and our own bodies?
Right. So I think the first thing to do here is to ask ourselves, why is this so harmful, right? Why is social media, especially like certain types of social media consumption and celebrity images, harmful to us? And I would say that they're harmful for different reasons. One, because they promote a certain standard of beauty and kind of exclude different types of images that could be considered beautiful. It really kind of sells like this one particular model, this one particular look in terms of what a quote unquote beautiful person is supposed to look like. Another thing is that the images that we see are highly edited and controlled, right? So even like the way that the images are portrayed or posed are highly, highly controlled. So we're really not getting an accurate representation of what the person actually looks like. So we're getting feed that is very, very polished and edited. That's not really showing us an accurate representation, but it's posing as normal life, right? And ultimately, I think that also based on all this, it maintains weight bias and weight discrimination, and that is harmful for people in all types of bodies, ultimately. So once we are kind of like aware of all this and really kind of develop an understanding, some of the things that we can do to begin with is to learn more about, what's behind this, what's the agenda here behind it. So we can start to learn more about diet culture, for instance. So here I'll just, I'll steal Christy Harrison's definition of diet culture, which I find is just perfect. Which is that diet culture is a system of beliefs that worships thinness and that equates it to health and moral virtue. So that means that we can spend basically our whole lives thinking that we're broken if we don't look like the impossibly thin ideal. It also promotes weight loss as a means of attaining higher status, which means that we're compelled to spend a lot of time, energy, money trying to shrink our bodies, even though the research is pretty clear, like I mentioned, that most intentional weight loss will not be sustained. It also demonizes certain ways of eating while elevating others. So that creates a sense of hypervigilance around eating, a sense of shame around making certain food choices, and we're distracted from other normal experiences in terms of eating, like pleasure, purpose, power. And it also oppresses people who don't match up with the supposed picture of health. So this disproportionately harms women, femmes, trans folks, people in larger bodies, people of color, people with disabilities, and it's damaging overall to mental and physical health.